Okay, thank you for having me here. It is quite a journey to get here from Amsterdam, but with a lot of help from my friends, I succeeded. What you see here is my wife and 2 kids. I'm terribly homesick normally, so when I leave house, I always take them with me on the picture.
You can pick up the microphone.
No, didn't you hear me talking about my family? Okay. Well, normally I take them with me, but now I take a picture so that you can watch them. This is a picture before in front of the Reichstag in Berlin, where I was last year with them. And it was a special occasion because I had been there once with my wife and now with my 2 kids. Why was it so special? Berlin is a remarkable city. It's a very old city, it's an historical city, and you do not see history, but you feel it. And working with researchers and clinicians in improving healthcare for patients, I most of the time tell them, you are here because of us. And I know that you're all very intelligent people, so you will know that you're here because of us, but I want you to feel it in the way I felt Berlin being a very old historical city. And that's very important. That's what I'm going to talk about. Inspire to Live is an organization that started in 2010. Eric and I, who is a crazy Dutch guy, initiated a fundraising organization. We climbed up Mount Alpe d'Huez on one day 6 times because that was not possible. And we've raised a lot of money, and then we got a question from an Indian company, Tata Consulting, and they said, okay, we will give you some money, but what do you do for the children with cancer in India? And normally Eric and I make up stories, and we looked at each other and we said, honestly, nothing. We simply do nothing for the children with cancer in India. We raised a lot of money because we had a lot of fun biking up mountains. But let us come back when we have the answer of doing something important for the children with cancer in India, because I realized at that moment that my bone marrow transplantation, I have a lymphoma and needed, after a couple of years of chemotherapy and immunotherapy, a bone marrow transplantation that cost around 100,000 euros. But treating a child with leukemia in India cost around $16, which means that you can treat 6,000 children with cancer in India for the same amount of money as treating one, at that moment, 48-year-old man in the Netherlands, which is simply not fair. And if something is not fair, you do something about it. Inspire to Live is doing something about it. We bring together patients, researchers, and clinicians. This is a photograph taken October 30, 2011, and one of the guys on the picture is Stephen. It's in Cambridge, UK, historical ground, where Darwin worked in the old days. We bring together patients, researchers, and clinicians because we think that's the way you should do it if you really want to implement the things that you have done research for, that you discovered. Because I faced the biggest problem of really contribute to patient, and that's what you have discovered as a scientist. Implementing in healthcare is so terribly difficult to do. And then you face the situation that it's been done in academic hospitals because they have a rather close relation between the hospital and the research department. But then you come to local hospitals in the US or local hospitals in the Netherlands, in Europe, and then we still do not anything for the children with cancer in India. So what is happening over there? Inspire to Live is an independent organization. We like to say things in a different way, and if we think something is not the way almost all the people think it is, we still say it. Because 10 million people die every year of cancer. And that should change. But what has happened in the past decades is that we have made it so complex that we're almost not able to have a clear view on what is really happening and what is really needed. For example, this man died of a melanoma in 2008. 2010, I don't know exactly. Well, he needed ipilimumab. At that moment, quite a successful drug for melanoma. Nowadays, there are other drugs much more successful. But he needed ipilimumab. But he was not given it in the Netherlands because it was not registered. We didn't know at that moment if it was safe enough to give him because of the long-term effects. We have a so complex registration process in Europe, but it's almost the same as in the US, that we were not able to give it to him because of the process, safety, whatsoever. So finally he got it, but a couple of days later he died. We speak about safe drugs and tell that people who are dying within 1 or 2 or 3 months. Our organization is very much inspired by the AIDS movement. And a couple of months ago I had a dinner with one of the 2 founders, Peter Staley. And that's the way we want to work. The AIDS activists would have called that drug, what the hell drug. Give it to them. Okay, if I drop that, so what? I would have died anyway. Activism is, I believe, really the thing that can help us improve the things that are needed for patients to have, in the end, a better quality of life. It's not about data, it's not about research, it's not about treatments, it's about quality of life for patients. So with for the man with a hammer, the whole world looks like a nail. And that's a very, very big risk in all our professions, also my profession. That you only look at the detail that's on your desk and you forget to look at the whole picture. But for us patients, quality of life, becoming 87 years old with a good quality of life, that's what we want. And we need data, we need research, we need treatments, of course. What prevents us from implementing it? The barriers. Okay, data, yes, it is important, like I said. Publication culture, connected to the reward structure. I gave quite a lot of talks about that subject too. It is important, and it's preventing us from doing the right thing. Privacy. Privacy is not an issue for patients. It's not a subject that we talk about. You can get anything from us that you want. Privacy is always brought up by people who want to protect something, who needs something for making products, earning money, or whatsoever. We're beyond privacy. Is not what patients think is important, because we're beyond shame. You know, we've been in hospitals where nurses had to clean up all the mess that we produced at that moment. So privacy is not a patient issue. Law and regulations, a bit maybe. Yes, in Europe we have now the privacy protection regulations that is being discussed, and which will probably prevent researchers from doing their work in a proper way. So we fight against this together with the research. But at this moment, law and regulation is not much of something that prevents us from doing the work. But it's brought up by people who do not want to do the work that's necessary. Cooperation. Okay, it can be improved. It can be improved and it must be improved. But I think there is something else. In the past 3-4 years, I learned a couple of things, and I think it was 3 years ago that Stephen mentioned the military-industrial complex, similar to the medical-industrial complex. And I dived into it, and I thought, okay, armed forces, industry, government working together, not taking care of the safety of the American people, because the military-industrial complex is not some theory from a left-wing anarchist, socialist. No, it's brought up by one of the most respected generals ever. I myself work in the world of finance. So if you think that healthcare has made a mess out of it, well, we've improved that. And there was an anthropologist I think 2 years ago, that he started to do his work in the London city. And he went to the London city and he thought, okay, if you fire the bad bankers, you will improve the world of finance and they will come up with better products. But after interviewing 2 years, people who worked in the world of finance, bankers, insurers, he realized that there is almost no bad banking, like there is, I believe, no bad research, bad healthcare or whatsoever. No, if you take away the bad bankers and you replace them by good people, nothing changed really. Because it's the system that prevents us from doing the right thing. Exactly the same in a medical industrial complex. Now, I dived into the work of Hannah Arendt, a Dutch philosopher. She was a refugee in 1933, Jew, and she first went to Paris, but when the Nazis entered France, she went to New York. She did a lot of work as a Dutch philosopher, and in 1961 she was asked by the New York Times to write about the Eichmann processes in Jerusalem. Eichmann was a German, a Nazi, responsible for 100,000, maybe more than 1 million deaths. And it's not that I compare, for example, bankers with Nazis. But the process that she discovered, which was below all the things that she saw and heard from Eichmann, told her that Eichmann was just a normal German doing his job, with a terrible outcome. And in healthcare, in banking, I think I only see people who want to do the right thing for patients, or for the people who have a savings account or an insurance. They only want to do the good thing. But it's now a quite normal thing to tell a patient that we are not allowed to give the drug because of safety. And the next day we have his funeral. Now the process that's under this is society in which we do not ask the question, are we doing the right thing? And we do not tell people what you do is not good. Like it's on the screen, most of the people who are doing evil do not question themselves if it's good or bad. And I think if we ask ourselves that question every day, are we doing good or bad? Are we doing the right thing? We can improve. And for that reason, I think it's very important to bring in patients in the discussion. Patients, researchers and clinicians. Because working together, really together on an equal base, in which we all have the right and the duty to tell what's necessary and what's good or bad in our work, we can improve. Now, I've worked until July 17 with an old, well, you could call him a researcher activist. His name is Dick van Beckham, and he discovered the bone marrow transplantation, so more or less he's the man who saved my life. He was almost 90 years old when he died. And every time in the past 6-7 years that I worked with him, it felt good to work with him. Having a phone call, visiting him, he came to me. And it felt good because almost never he agreed with me. On his funeral, and there was a talk by one of his employees who came to the organization where he was the director, the radiobiologic center in the Netherlands. And he said, when I was going for a job and had this conversation with him, I left. And I thought, okay, well, I will not get that job because I have never, ever spoken to someone who disagreed with me so much. The next morning I got a phone call. He said, Bob, you can start next Monday. Working together, patients, researchers and clinicians, and really ask, what is your opinion? What should we do? What's best for all of us? That makes the difference. That can improve. Because then we will not forget what is happening around us. And it's my belief, probably I'm convinced, that this is exactly the same in the world of finance, in the world of the army, in the world of healthcare, and if I dive into other industries, it will probably be the same. We have lost contact with the purpose of our activities. Now, primary cooperation, 3 groups, patients, researchers, clinicians, when we meet our subjects that we work together with, then we can come to what I call the ultimate cooperation. We're bringing industry, if it's necessary, industry. Most of the time we speak about pharmaceutical industry, but how about the medical equipment? We bring in government if it comes to law, regulation and so on, health insurance when it comes to reimbursements. But we need from all these groups, all these stakeholders, their real interest. So a pharmaceutical company who said, it's my interest to help patients and do research as it should be, I tell him to get out of the room, come back and be honest. It's about profit. And there is nothing wrong with profit, but be honest about it. For 8 years I was an account manager for an IT company, and the only thing that was interesting me was sell like hell. It's all about the profit, and there is nothing wrong with it. I want to know what's the interest of the people around the table so that we can go for the win-win and change the system and improve and immediately start. Make the first step shortly after the moment that you have spoken with the people that you have to speak with. and ask every day when you make these steps, am I doing the good thing for these two people, the patient and her loved one? And it's been done before. People who did the things that they thought were necessary in their field of expertise. A couple of months ago, we had a congress in Amsterdam about lung cancer. And then a scientist, oh no, it was a doctor. She stood up and said, nobody invites an historian to a lung cancer congress. But Inspire to Live does. I said, yes, because we think that we should do something about the tobacco industry. And I hate the tobacco industry, but next to the emotions, because of all the people that die because of that tobacco industry, I want to have the arguments why we should do something about it. And the arguments are no longer scientific about the effects of smoking on lungs or whatsoever. We know that since 1953. The arguments about the tobacco industry are because of the politics. What do they do to influence the lobbying, etc.? That's the reason why we bring in different opinions. People with other thoughts who don't bother bringing up something completely different from what the group they're facing has as an opinion. Because I don't know who discovered the water, but it certainly wasn't the fish. So if you want to change, bring in people with different ideas, perspective, and so on. My favorite slide, my last slide. It's about people. That's our job. I thank my life to Dick van Beckham, a researcher. So I know that science can make the difference. But it's our job, not only as patient advocates, but as patients, researchers, clinicians, to make the difference for patients. So the most beautiful statement of Martin Luther King will be my final remark. And that's the most urgent and persistent question in life, is what do you do for other people? Thank you.